Okay, so higher social motivation. Yeah, I remember giving a talk once to parents of autistic people, and one mum stood up at the end and she said, the thing is that boys are interested in things and girls are interested in people. And it was a total generalization, and obviously, on one level it's unhelpful because it's sort of stereotyping things. But on another, I think it does give us an interesting insight into an important autism gender difference, which is, there is certainly in my clinical experience, but also based on Rachel Hiller's and Alexandra Head's excellent work, both coming out of Australia. There's clear evidence that autistic girls and women are, on average, more interested in friendships, more interested in the social world, more motivated towards, if you like, participating in the social world than are their kind of male autistic counterparts. Now, that doesn't necessarily mean, of course, that these girls and women will have an easier time in the social world, and in fact, it could mean quite the opposite. In that, certainly in some cases, it can be. I've seen some autistic kids where it's almost a bit of a curse. They're interested in social relationships because it can open them up to so much rejection and the sort of missing out on something that they dearly want. But nevertheless. The evidence is there that autistic females have higher social motivation than autistic males. Okay, so a key part of autism, and I think often one of the kind of areas of strength that I mentioned earlier in the talk, is that autistic people often have very focused interests that they pursue with great passion and intensity. Yeah? And these are part of the diagnostic criteria for autism, and they can often drive people towards expertise and developing sort of skills that are useful to them, to the culture, and also actually can be really helpful in people kind of forming a positive identity of themselves, because they, if you have a passion, then that can be very helpful in terms of your sort of well-being and identity. But what is interesting is that there seem to be gender differences in the kind of nature of these focused interests. So I always remember, the story I always tell to sort of illustrate this is, I remember once when I was working in a child assessment clinic, I went to pick up a boy from the waiting room, and there he was, dressed in the waiting room, as a driver on the London Underground, on the tube. So I thought, okay, here's an in for me, I've got something to talk to him about. So I said, oh, so you want to be a driver on the tube, do you? And he said, no, I want to be a driver on the district line. Which is one of the roads. So when you have an encounter like that, you think, well, why am I now going to spend 3 hours assessing this kid? It jumps out at you, doesn't it? You think, okay, and if you said that to your teacher, if you said that to your family doctor, immediately they're thinking, okay, this kid may well have autism. This could help us understand this guy. Now, my argument is that females are less likely to show their focused interest in that sort of way. They're more likely to be, if you like, gender typical and even somewhat gender stereotyped. So, lots and lots of, well, in fact, I'll go on and give you some examples in a minute of that. More gender stereotype, but also just more sort of normative, less sort of strikingly unusual, although still pursued with an autistic intensity. And so, if I remember, again, one girl I worked with who was very, very interested in fashion, totally typical interest for her. I think she was 11 or she was 12. But what was interesting was the way she pursued it. And for example, again, I remember one of her sisters borrowed a pair of her shoes and they had a fight over it. Again, not an unusual thing to happen, but it was kind of triggered by the fact that there was one particular sequin on that shoe that had been moved out of place by the sister, which then caused a really substantial meltdown in this girl. So you begin to get a sense of actually that in a sense, these are not odd-looking or unusual-looking focused interests, but they are pursued with a particular attention, a focus, and an attention to detail. Now, Rachel Hiller, again, has done good work on this. My student, Rachel Looms, is also sort of in the process of doing work in this area. And I just wanted to present a little bit of this work just to give you a flavor of what I'm talking about. So what she's done is she's designed a kind of whole new set of codes for ADOS videos. The ADOS, which is this measure that people use, this excellent gold standard measure for assessing whether somebody has symptoms or characteristics of autism. She designed a set of codes that you could use when watching ADOS videos to try and code gender-specific elements of the female phenotype in order to test out ideas about whether there were systematic differences between males and females. And one of the codes she had was she would code, if they came up, she would code special interests of the person in the ADOS. And she got it down to having these two kind of categories of special interests. The first were interests that were kind of social, and that meant either they were pursued socially, in groups of people, or they were kind of reflected some sort of relationship or interested in animate beings, be it animals or other people. And then she had, in contrast to that, physical interests, which were things that tended to be pursued in a solitary way and which were not primarily concerned with animate beings. And again, this is pretty rough and ready stuff, and it's not been published yet, so you need to treat it with some caution. But I think it does help to make my point. So in one column, you've got participants whose special interest was basically classified as social, and the other was who was classified as in the more physical domain. And what you can see is that there are many more. Most of the males fall into the physical domain. Trains, roller coasters, computers, science. Only a few of the females actually were in there, whereas most of the females had interests that were classified in the social domain. And again, I see some of you sort of nodding in recognition. Animals is incredibly, sort of prominent there, isn't it? And I do sometimes wonder whether, and I'd be interested to hear from some of the autistic women we have here today, or clinicians and anyone else really. I do sometimes wonder whether having a real interest in animals is a really nice way to have a kind of relationship and to sort of satisfy perhaps sort of social motivation you might have, but to avoid some of the complexities and pitfalls that can arise in having that with other people. Animals, reading, dancing, and so on. So I hope that gives you a bit of a flavour of what I'm talking about. And I think this is important for the conversation we're having about diagnosis, because again, if you go to your family doctor and say, my daughter, she's not she's struggling to make friends at school. She feels sick before she goes to school because she's so worried about it. She just is very quiet at school, and then she comes home and all hell breaks loose, and she's really obsessed with ponies. Yeah, that, you'd probably start to think, oh, is this a sort of social anxiety thing? And whereas, if you come back and you say, my boy, he gets sick before he goes to school, he's not making friends, finds it really hard, and he's obsessed with becoming a tube driver on the district line, I think you're much more likely to think, okay, let's get this kid a referral for autism. So I think this stuff really matters, actually, because it can often be these special interests that are most kind of striking, I suppose, when you're thinking about whether somebody is autistic. Okay, now one thing you might have noticed about some of these autism, sex/gender differences that I'm talking about here is that they generally probably reflect gender differences in the general population. They're not sort of, they don't look strikingly unique to autism. They seem to largely reflect general population gender differences. And this next one is very much in that category. So we know that autistic people have a really high likelihood at any one moment in time of experiencing co-occurring mental health difficulties. So amongst kids, we know that anxiety and difficulties with sort of behavior regulation, ADHD, and I suppose OCD to a lesser extent are really common, and there's particularly good studies have been done in this area that show that at any one moment in time, kids who are autistic, from a community sample, bear in mind, this is not kids presenting in clinics, 70% of them will meet diagnostic criteria for at least one other mental health condition, and 40% meet diagnostic criteria for multiple mental health conditions. So, mental health, co-occurring mental health difficulties are ubiquitous in autistic children. They're also very, very common in autistic adults, particularly with depression and anxiety being very, very common amongst autistic adults. And the picture that is emerging from the literature is that the gender, if you like, the pattern of risk, the constellation of risk for co-occurring difficulties has a somewhat gender-specific nature. Which is that females are more likely to experience so-called internalizing difficulties, difficulties with anxiety, depression. Males are more likely to be diagnosed with so-called externalizing difficulties, difficulties of behavior regulation, difficulties sitting still, and so on. So it's not just core autistic features we need to think about when we're thinking about gender differences, but also the pattern of sort of co-occurring difficulties, which can, after all, have a huge impact upon quality of life and also on recognition. So again, if you think about the boy who sits, who can't sit still, autistic boy can't sit still, flies off the handle perhaps if demands are made on him where he's asked to make unexpected changes, he's going to be notable to his teachers. He will be on their radar and they will be trying to, if you like, solve the problem that he poses them. And they will be thinking, okay, what's up with this kid? Maybe we need to get him an autism assessment. Now, if you think of a girl who is not experiencing conduct problems or oppositional sort of emotional dysregulation in an externalizing way, but is highly anxious and unhappy, who sits quietly at the back of the classroom, desperately trying not to be noticed, trying to blend in and just get through the school day keeping her head down, she is much less of a problem to her teachers. She's much less likely to be noticed by them. And so I suspect that this different pattern of co-occurring sort of mental health conditions could well be playing into the diagnostic bias against females. And I'm going to present some evidence, in fact, on that point a little bit later on. Now, the fourth sort of element of the female autism phenotype that I would like to draw attention to is to do with what we call camouflaging, or social camouflaging. And the point I'm making here is that there's evidence that females, autistic females, compared to autistic males, have a greater interest in and capacity to camouflage their autism.